Good afternoon, GYANU. I will ask one more question, then Kavita will continue with you. Can you remember one good experience and one bad experience from a mother which you come across in your profession?
See, there are lots of good experience because when I leave the family and if they give me a feedback and that I did my work uh, for what purpose I came, I did it. I mostly heard from the clients, and I think that is a good experience, and that is also the main objective why I am to the family. And the bad experience is one time I was by with the Moroccan's family, and I didn't know that she had also a problem for the
Okay.
psychiatric
Yeah, yeah.
problem. And it was also like I also at that day I take a care over from my colleague, and my colleague didn't specify the everything's in the report. If she would have specified that mother is suffering from this, I would have handled in another way maybe. But I didn't know. I take it over. It was also a new phase for her, and it takes a time to build a connection that you cannot in a day one. You cannot build a connection with the mother and yourself. It takes a time for me also for the mother to be connected. And I went, maybe she had also a bad night at that time, I didn't know. And I asked her, shall we go for it was a feeding time, and she fed, but the baby was not latching properly. And I tried to give an advice and also the experiments how I did with the other clients, but I think she was not liking that, and she was feeling that I'm forcing her to give a breastfeeding. But I was trying to help her by giving every advice, then she can see which one she likes or not. But what happened immediately, she called to my office, head office, and she said, I want this lady to leave my house now. And I think that was only the bad experience I still remember.
Okay.
Yes.
That must be hard for you.
Yes. I was like, I'm someone who, if I'm to the family, I give my heart because I love my work and I do it from my heart. But I was wondering, what I
Yeah, yeah.
did. I also still, yes, and I also asked to my colleague that who received the call that what was the complaint, and she told me at that moment that she is not in a good state. Maybe her mood was swinging, that's why she was asking us to leave the house.
Okay, so in Netherlands, it is quite common to have home birth as well, which is completely different from Nepal or
Nepal,
India or
yes,
other
yeah,
Asian
yeah.
countries. So, how do you find the difference between mothers or the parents who deliver at home and who are delivering at
At the
hospital?
hospital.
Are
Okay.
there any significant difference?
Yes, because sometimes there will be the situation that you need to give a birth at home. There is no time to go to the hospital, but some parents they prefer the house delivery, and they are mentally prepared for that. And the parents who are mentally prepared, they always have a good experience. They say we feel like a very safe, comfortable on your own, no strange people coming and going, you have a one face, and that's comfortabling me, and it was easy for me to give a birth. But the parents who are not ready, that they were ready to, prepare to give a birth to the hospital, sometimes it's also like a trauma. Yes, that's why you have a both clients that they are happy, and the other one they are not happy because they were not prepared, and it's also like a trauma. Maybe anything can happen at that time. Then what was happening to me and my baby? That's why when if someone is prepared mentally, they are very happy.
Okay, so your advice is for mothers to be prepared for
Prepare,
everything.
yes, because for the delivery we cannot plan. It can happen everywhere at any time.
Yeah.
That is it.
So the babies who you have had experience with, what is the maximum weight that you have dealt with, like a baby's weight that you have dealt with?
Okay. It was like, I don't remember the exact, but the maximum weight was like a 4 kilo 300 something.
Okay.
Yeah, I don't know precise exactly, but it was 4 kilo 300 and it was like,
Yeah.
yes.
Right. So, is there any difference in babies who have like less weight and trying to you are trying to help them gain weight and
See, if there is like we say a premature baby, and premature baby is always like early the weeks and also the low weight, and for them it's very we know because with the premature baby, it's very difficult to come with the weight. Why? Because a premature baby they normally have also like a low temperature. It's very difficult for them to bring the temperature up, and once the that's why we will have to figure out why the baby is not gaining the weight. Maybe it's also we are feeding, but the temperature is not good. It will be difficult for the baby to come up the weight. That's why figure out from where the baby is not coming. Temperature is good, still the baby is not coming. Maybe there is a feeding problem. You also do a feeding good, everything is proper. We give with a bottle the exact quantity what the baby needs. Still the weight is not coming, but we have we say we give a 2 weeks time until the baby comes in their birth weight, and within a 2 weeks also not coming. Maybe there is some inner reason that we are not how to say, I'm not qualified for that to figure out, but my duty is within a 10 weeks we do our best. If there is also not happening within a 10 days, then we give a report to the consultancy bureau or the midwife so that they can handle it further.
Okay. The babies that you have handled, have you faced any of them like really having severe problems or something? Then you have to like had to take them to the hospital or something.
Luckily, I didn't have experience with such a babies, but I'm always prepared because anything can happen. And when I am with the family, I am the one who can, take the control over the situation. That's why we also like every year we also get EHBO course that if something happen, what is the first action? I didn't experience yet, but I'm prepared for that.
Hope you will not experience in future
but
as
you
well.
never know.
Yeah.
You never know.
Yeah. How do you feel when you leave a family after 10 days? What is your feeling in general?
Honestly saying, I don't like the last day. Honestly speaking, I don't like the last day because I know it's a day to take a departure from the home, and once you come to the family, you are so much connected. Like as a family, you are like for a maximum 8 hours or minimum 3-4 hours. You are connected to the family. You feel like a family, and the last day. Most of the clients they get also emotional, and me too, because I'm working in this field like let's just say this year will be a 8th year, but still it's difficult to hold my emotion by the last day, because I said no, I will not cry, I will not get emotional, but when I hugged or something the tears fell down, maybe because I'm so much connected to the family. It's very 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 difficult.
Could you explain how the healthcare system in Netherlands work when you find out that you are pregnant from day one until the delivery of the baby? How does the whole system work for someone who is new to the Netherlands?
Okay, especially when the lady finds that she's pregnant, first of all, she can go to her own GP for a urine test to make sure that she is pregnant. Or she can directly find a midwife nearby her area where she can go and see, how many weeks or if she is pregnant, officially pregnant, let's say. And then after if she choose to go for a GP, then they advise you search for a midwife nearby you, or you prefer any specific language or something like that, then all the things, all the controls will be taken over by the midwife. And once you go to the midwife, you will have like a monthly or a weekly checkups. But if they find also something unusual that couldn't be handled by themselves, they will send you to the hospital. Then the hospital, the special gynecologist, they will take the whole care, they will take it over. And for the just say as a maternity nurse, for maternity nurse, and where you go to the midwife and you are new to the Netherlands, you don't know how the maternity works, then they will also, your midwife also advise you. If it is listed by her, few maternity offices, they work together, she will give advice if you can go and look to them. Or you can also find yourself searching for a maternity nurse. There are very much websites that you can find a group of maternity companies or group of freelancers where you can choose which one you want. If you want from your own the language that you speak, or it's also flexible or like that, you can find with them. Once you find you are sure that I want with her, then you take a contact with the office or the freelancer. Then they will ask you how many weeks are you going, and you say maybe 15 or 16 or whatever you are at that time. Then during 25 to 30 weeks, they make an appointment for the intake. Intake means that to introduce to know each other and to say the things what we are going to do by the coming days. And once the intake takes place, they comes for especially if it is your first baby, then they will plan for a home visit. But if it is for a second one, you have a little idea of the maternity nurses, so they will plan only for a telephonish. And once they come for a house visit, they will explain you what you needed during your maternity time, or if you have also questions regarding to what stuff should I buy before, because it's a first baby for me, I don't know. And they will also help you to list down the things, buy this one from this size and that everything. And at that time they will also explain you that when you should take a contact with them again, because your the growth of the baby, midwife is taking over, and they will explain you that once you started with the contraction, is especially not necessary to give them a call to the maternity nurses, but once you go to the hospital, you give them a call so that the staffs are ready, that okay, the lady is going to deliver, we are ready here. And once the baby is born, and once when you leave the hospital, then it's like we say 3 times you call to them. And if in betweens, before the baby is born, if in betweens there is a questions regarding to anything related to the maternity nurse, you can take a contact with them. And once the baby is born, like we say here in Netherlands, also depending on your insurance, how many hours you are getting, and also depending what you want. Some prefers to take a full hours, 8 hours per day, but some said, yes, I'm also fine with the 4 or 5 hours. But most of the people, they take 5 to 6 hours as very normal. And it also depends whether it is your first baby or whether it is your second baby. And let's say if you deliver today, in the afternoon, and the hospital wants to admit you still for the whole night to to observe the baby and also you, then the hours will also be cut down from the total hours. If you stay at the hospital, one day is gone, tomorrow you are back to the home, then we will come for until the day 8. And within these days, if there is any complications or something like that, that you need extra days, then the maternity nurse and midwife will consult with each other if you need an extra days. And if they find it is needed, then we give an extra 2 days. That's why the maternity days will be until 10 days.
Okay, and what happens after you leave the 10th day?
Yes, because like when the baby is born, you need to register by the municipality, and once the baby is registered, it will go automatically the information to the consultancy bureau. And consultancy bureau is they take they control the babies from the day of birth, like say until 4 years. They will check the every growth and what where you need help or something like that. And when the like information is gone to the consultancy bureau, they will send you a letter for the invitation. Especially you get first 2 letters, one for a hearing test and one for like a house visit. And it's like an official appointment with the consultancy bureau. Once they come for the house visit, they explain you everything. When the we are finished and the 10 days, at that point, if you have some questions or something like that, then you can always contact with them consultancy bureau. And everything after 10 days, midwife is finished, care from midwife is finished, care from maternity nurses is finished, then they will take it over. Then they will keep on eyes whether it's going good or not.
Yeah, and they also include vaccination.
Yes, everything related to the baby until 4 years, they will take it over.
One question about home birth. So people like us from Asian countries like India or Pakistan or Nepal, we say we have advanced healthcare system, and we always advise women to go to hospital for giving birth. And Netherlands being the modern or the first world country, most people still prefer to deliver at home and they're comfortable with that. Why do you think it's safe here in Netherlands and people prefer to birth at home? And how much do you think the percentage of home birth here in general?
Yes, see, there are both two kinds of people. One, they want to give a birth at home, and the other, they prefer to the hospital. And the home delivery, who prefer to give a home birth, is mostly from a Dutch. What I have also experienced in my life is like from Dutch people, they prefer to give the birth at home. And there is a very few percentage. That's what I mentioned also earlier, like maybe it's a situation that she needs to give a birth. And I also think that the insurance plays also a great role here for the home birth and also for the hospital. Because if you go for a home birth, like from your basic insurance, you don't need to pay the extra like additional charge that you pay to the hospital. For the home birth, it's like a free. And maybe if someone is having a financial problem, and maybe they might also save the 600-800 euros. And here in Netherlands, the midwives are like much they also get, during their education, they get a lot of training also for the home birth. What if this situation happens and this and that, they are always prepared. And also the third one is like maybe in abroad countries, there is always a shortage of staffs. That's why in a healthcare, wherever you follow the education, you always have a basic knowledge. That's why midwife here, they are certified to help a lady with a home birth. Maybe that's why it was also like people feel safe. Okay, we can also go for the home birth, and also listening to the experience what the other have experienced during the home birth. Maybe that might be also the reason that they are safe. But in our country, let's say like to the Asian countries, it's no one will come if you are like say going to labor, they rush to the hospital. No one is there that take a responsible, no, let's do for a home birth. Maybe they are not so much certified or experienced for the home birth, and also let's say the lack of facilities, of lack of things, maybe that was also the reason. And if you ask how you compare how many percentage with the home birth and the hospital birth, I would say like it's like 30-70. It's a home birth is like a 30%, and the hospital birth is like a 70%.
Okay. The last question, probably. What is your advice in general for new parents who are not Dutch, who are from other countries and without the support of family, taking over the parenthood for the first time?
See, I say first believe in yourself. It's a new challenge because there is a newborn baby who can't speak, who can't communicate with you. It's like a very big challenge. And first I say have a patience, believe on yourself. Because today's if there is something happened, you don't know, and there is no maternity nurse available. We have a so good technology. You can find a lots of information also on YouTube if you need to do some, immediate action. First of all, I want to say believe in yourself, have a patience, give a time. Because with the first baby, you need a lot of time. Body is changing, like responsibility is increasing, and yes, I know it's like sometimes, also for the couple, it is difficult that there is some baby and how to share your responsibilities and how we can handle this one. That's why become maternity nurse is also here to give you extra advice and instruction. Believe yourself, and first of all, mother you yourself is important. If you are healthy, if you are fit, then the baby will be fit. But if you are not, if something happens, there is a mother's instinct. You know what to do because your heart and brain will give you like an action. You do this because you cannot, as a maternity nurse, me also, I cannot also be prepared for the every situation. There is always a strong instinct. You do this one. You always listen to the mother's instinct. That is what I want to advise.
Thank you. Thanks a lot for your patience and answering all our questions. Hopefully, most of it, or like really, will be helpful for all new parents here who are new to Netherlands, new to the system and everything. And thank you for being the amazing maternity nurse for us and our family as well.
Thanks to you also, because it's also like a first experience for me to sit on the camera, because something is there and I'm giving like an interview. It was also a good experience because I'm going back to my old days, and it was also for me nice to share my experience. I hope these videos will help to the newcomers or like a new parents, and about through my experience, I hope it gives a little help to them.
Thank you.
Thanks to you also. Thank you.